welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Ben Aiken. He is a family physician and healthcare executive, and he wrote the Kevin MD article, High-deductible health insurance is bankrupting Americans. Ben, welcome to the show.
Thank you. Good to be here.
So we'll get into the article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I'd be happy to. So I'm a family physician by training. I have a background in public health as well. I have a direct primary care practice. So I do practice clinically. About 25 to 30% of my time is now clinical. I launched that practice actually as part of a big integrative health system, which is a little bit atypical for that model. But then that health system was bought by a much bigger health system. And so I bought the practice from the much bigger health system that was not interested in our approach at the beginning of 2020, just prior to the pandemic, and have been operating it for the last couple of years. 75% of my time is now working for in essence, a startup insurance company called Decent Health. On the side, Decent Health builds its insurance offering around direct primary care, which is how I got connected to them, but love the entrepreneurial and kind of more system level thinking, and have been in that role since October of 2021.
So for those listeners who aren't familiar with the direct primary care model, can you give a brief description of what that is?
Indeed, yeah. Think of it as just an alternative payment form for primary care. More or less, it is a membership model. A lot of people think of, hey, it's a gym membership type approach to primary care. So our patients pay us a monthly fee. And for that monthly fee, they get unlimited access to us. And we just basically take insurance out for that component.
So I've had several direct primary care physicians on the show, and one thing that you mentioned struck me. You said that large integrative health system that you were previously involved in didn't want a direct primary care practice being part of them. Why do you think large systems are hesitant to include direct primary care models?
Yeah, it's a good question. I think some feel it is a bit threatening to them longer term. Health systems generally are driven by volume, even with all of the value-based care initiatives. And if primary care does a really good job at what it's supposed to do, theoretically, there's less downstream kind of revenue at the health system model. I think forward-thinking health systems around the country are really, and those that are becoming integrated, they have the primary care component, and they have the hospital and specialty component. And there can be a way for that to work well together. But certainly that potential downstream threat is one reason. I think the second is that most are really used to living in an insurance-driven world. Mm-hmm. And this idea of kind of taking that out, one feels perhaps a little threatening to their insurance contracts, which are really, really important to them as health systems. And it also feels a little bit unproven. And so kind of willingness to take risk on something that primary care is very low margin, if there's a margin at all, generally for health systems. And so to kind of take risk on trying a new model or testing it just doesn't seem to be a particular driver for health systems. The regional health system that I was a part of, I feel like was one of the more forward-thinking health systems called Mission Health. Think of Kaiser's and Intermountain and Geisinger, some of these health systems that people look to around the country that are really pushing the envelope in primary care. And then the system that purchased that is called HCA. It's a massive, one of the biggest in the country. And they just don't actually do primary care. So their lack of interest in us at that point was really because primary care is not a focus for them. And that led to us transitioning out of the system.
So right now, direct primary care is a relatively niche role in our country. It's a minority of practices, clearly. So what will it take for direct primary care to gain a better foothold into mainstream primary care?
Yeah, it's a good question. I want to say last I heard it's maybe 5% of family physicians are in a direct primary care model. There has been good traction in it maybe 3-ish years ago or something. It was 2.5%. So there is clear growth and interest, especially as all of the kind of systemic forces are putting pressure on fee-for-service primary care providers that just make the experience really pretty poor. So I think that if those forces continue, then there will be continued kind of interest amongst physicians themselves for looking at alternatives. I think that we're probably in phase what I would call 2.0 for direct primary care. The original phase 1.0 were really the vanguards, the folks that pushed the envelope at the beginning and said, hey, we're so fed up with the system. We're going to hang up our own shingle. Don't measure us. Don't track us. We don't want to engage at all. We just want to stay out of the system. And I think there's a place for that in a long-term capacity. I think phase 2.0 is kind of, I guess, the phase that I've been a part of, where we've been monitoring this for several years, perhaps a little more risk averse than the original vanguards, but also kind of raised in a system where there were some metrics and a little bit more emphasis on kind of a connection to the system, but still really feel for now that being outside of it is appropriate. I think phase 3.0 is going to be basically what we see probably in the next 5 to 10 years, where insurance companies and systems and various other folks that are kind of still in, I guess, what we'd call the broader status quo system, start to say, hey, this just makes a whole lot more sense. Whether you call it a capitated payment, whether you call it direct primary care, advanced primary care, there's various different terms that are out there. I think there is enough data out there to prove the value of the approach and the alternative and payment structure, and where I don't know exactly where it will play out. But I think as that becomes more mainstream and more providers are fed up, I think it will become more of a norm. Medicare is piloting paying for this now in over 10 states. I'm not in one of them, but a lot of folks also follow what CMS and what Medicare is doing. And so there's a lot of debate in the direct primary care space about whether or not direct primary care physicians should engage with Medicare and actually allow them to pay that monthly fee on behalf of the patient. So I don't know where that necessarily will play out, but I think that there's a chance as those bigger kind of players like Medicare and CMS start to pay for things in this way, that will be kind of the tipping point where this could potentially be much more than just a niche.
All right, let's transition into the Kevin MD article that you wrote. It's titled High-Deductible Health Insurance is Bankrupting Americans. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, sure. So I think that, high deductible health plans are becoming much more of a norm. They've grown exponentially over the last many years. And I think that in general, there's just kind of an acceptance that, hey, these are good things. Like, they actually are designed around allowing patients to save money in a way through health savings accounts and other things that can serve them well in the long term. But as I have learned more and more about the insurance space and really kind of tried to think a little bit about this movement towards high deductible health plans, kind of underneath the surface, I actually found quite a few concerns that these aren't actually kind of playing out the way that they were originally intended to, and or benefiting the majority of folks in a way that we would have expected, but rather actually a reflection of the fact that over the last 20 to 30 years, individual beneficiaries of insurance, so individuals in our country and businesses who pay for over 50% of Americans get their health insurance through employers, are the ones that more or less increasingly the burden has been shifted to those folks, both the people that are paying for the benefits, and high deductible health plans is just another manifestation or a pathway in which that has happened.
So give us a case study or an example of, say, a typical patient or family that has a high deductible health plan and shoulders a disproportionate burden of costs, and how that can be financially crippling.
Sure. Let's say that you have a family of 4 and they are now in a high deductible plan, with each individual in that family having a deductible of around, so let's say $5,000. And we'll just focus on that, not even focus on the out-of-pocket maximum. But let's say that that's a middle-class American family and they have, let's say, two needs as a family over the course of the year, and basically are out $10,000 that they otherwise would not have paid. For most American families, that amount of money is actually quite significant and hard to, basically, whether it's paying for their mortgage or their lease or keeping food on the table and that sort of thing. That amount of money in any given year for most American families in the middle class actually is not a small amount. So there's there's that potential risk that if they have something that happens. Of course, the benefit is they still have insurance. And so most can figure out a way to try to wrangle up, I guess, the $10,000 to get that paid for. And hopefully they don't go bankrupt as a result of that $5,000 or that $10,000 expense to cover the cost of their deductible. So, yeah, people go bankrupt every day in our country because of healthcare expenses. So hopefully that is avoided. So there is a purpose and there is a function as it relates to that insurance plan, even though there's that big initial hit that a lot of people have a difficulty getting over. The second thing I just touch on as it relates to that is that the premiums that family is paying haven't gone down. Mm-hmm. So, I mean, in some ways you think, okay, hey, if we're doing this higher and higher deductible health plan, it should be cheaper. But what we're still seeing is that the premiums for that health plan are still increasing at quite a significant rate. So not only are people paying more for this on a monthly basis, whether they're utilizing services or not, there is that. So it's kind of a double whammy. So one, they're paying more for it, and that is an increasing percentage of their regular monthly spend. And then if something happens, they are out $5,000 to $10,000, basically $5,000 per individual in that family. So those two things combine in a way that really have an influence. The third and the final, which is part of what I was really trying to get at in the article as well, is there's a lot of emphasis on this idea of, okay, well, hey, even if you have a high deductible, we're going to give you a path to plan for that. We're going to give you what's called a health savings account. Most commonly, there's flex savings accounts and health reimbursement accounts. There's different approaches, but health savings accounts or HSAs are probably the most commonly talked about and seen. And so, hey, middle class American family, like you've got this high deductible now, but we're going to help you plan for that. We're going to give you an HSA for you to basically put money in. And the intention around that, it makes good sense. If you don't spend that money, you've got savings, you can build it up over years. It's actually a mechanism to kind of have an alternative retirement account. Like there's lots of good kind of seeming incentives to utilize this HSA. But if you're a middle class American family that's having to pay more for your premium, so you have less disposable income on a monthly basis, realistically, what we're seeing is that people aren't utilizing the HSAs. Mm-hmm. Like they don't actually have enough money to put into that HSA. So there's not room for them to save for that potential expense. If that expense happens, it's a clear burden. Yes, they're not going bankrupt, but it's still a very clear burden. And on a monthly basis, they're paying more for it anyway. So it's not actually playing out in kind of reality as it was intended to play out.
So I see our high deductible health plans kind of at the crux or intersection between different ideological approaches to how we can solve our healthcare problem, right? On one hand, you do get access, but on the other hand, you do also, have that sense of personal responsibility and self-direction that some people like to see more of in our healthcare system. So I was wondering, what kind of paths forward do you see from the issues that you described?
Yeah, it's a really good question. And I would agree with you that, if you will, kind of, I guess, having some skin in the game or some type of kind of, being on the hook or kind of so that responsibility piece is there is a very reasonable thing to desire. So I would say that I don't think that high deductible health plans are going away, but I think that there could be some focus on trying to cap those at a more reasonable number. So rather than next year having the deductible hit $7,000, what if we actually thought about trying to keep it, closer to $2,000 a year, so that there is some kind of skin in the game, if you will, so that there's some incentive for you to try to stay healthy. I mean, that's what I think the kind of underneath that question is really, how do we actually incentivize health across the spectrum of society? And there's a lot of inputs and environmental influences, social determinants, all those things. But, how we utilize health insurance and pay for care is certainly one. So some emphasis on having a stake, but making that more realistic for the middle class folks, I think is an important one. I think thinking about, and I don't have this one figured out, but thinking about in some ways either a mechanism to really actually better allow for or incentivize something like an HSA is something to consider, or perhaps just shifting away from that as a realistic path and refocusing in our kind of health plans around more just serving what their purpose is rather than kind of being some kind of an alternative retirement vehicle or savings path or tax break, that type of a thing. The place that I'm probably most interested in is decreasing the overall deductible. I spoke to thinking about alternatives or basically kind of shifting away from this idea of an HSA as being a realistic path. But what's the actual nature of the health plan itself? So that's where I would say that I'm the most interested in, and part of why I was attracted to the work at Decent, which is, can we in some ways actually build a health plan to look different, where the core foundational things, let's say the 80% of needs that most people have, the primary care aspect, is really done in a way that's much more consumer focused, much more accessible, and not disincentivized in a way at all, right? So think of kind of basically, in a basic way, 100% free primary care, physical therapy, and mental health support. And these foundational elements that really help, allow that stuff should just be easy, and you shouldn't have to think about it. You shouldn't have to think about copays. It should just be covered. And if we allow that to happen, can we then have a health plan that is actually more affordable and longer term, is built around kind of hedging on the savings that you would get from incentivizing those things. So I think that would then facilitate you to have a health insurance plan that doesn't go up 8 to 10% in cost every year with premiums, where the deductible is actually more tolerable and doable for a middle class American. So that's where I'm most interested.
Talk to me about some of the headwinds that's preventing your vision to come true. So why don't more health insurance plans focus on primary cares and make deductibles for primary care related services much lower? Why isn't this happening?
Yeah, it's a good question. I don't have all the answers. I'm trying to learn as much as I can on this stuff. As you well know, we don't necessarily learn a whole lot about medical insurance and how it functions, health insurance, through the medical school process. Status quo is hard to shift. And even, nonprofit providers of health insurance plans, there are margins that need to happen. And the way that a lot of those folks think is built around this kind of 80-20 rule, where basically, you're boxed into only kind of taking a margin on 20%. And so there's this inherent incentive for the overall size of the pie to continue to grow, because if you can only take 20% or kind of glean, a margin from 20% of the pie, really the only way to do that is to make the pie bigger. So there are some fun, and the Affordable Care Act had some influence on that, even though it also tried to solve some things, and I think did a decent job in some ways there. One negative consequence of it is basically that kind of pie equation started to happen. So most insurance companies are clearly incentivized for the size of the pie to just grow on a yearly basis, no matter what. So even if you're doing a really forward-thinking job, incentivizing value and changing the structure of how primary care is paid and that sort of thing, you just want costs to continue to go up. So that's one thing that I think needs to be thought through thoroughly, and will require some legislative shifts that really probably regulate and deregulate certain aspects of how insurance functions, especially on the fully insured side. And businesses around the country are really probably the most forward, most innovative as it results to examples of how this is done. And that is done through what's called self-insurance. So where a company of a certain size says, you know what, we're going to take the risk and basically, in essence, create our own insurance plan. And then we're going to put the elements that we want to put in there to incentivize things like really open access to primary care. There are quite a few examples of companies around the country that have been doing this for 25, 30 years. One that comes to mind is Rosen Hotels, ROSEN. And there are folks on the benefits broker administration side that are really trying to drive some of this. There's a group called Health Rosetta that is a real leader at a national level on that front. And they're basically saying, hey, we've learned some lessons of how this can be done. You individual business, here's your broker advisor, here are the components that you need. Here's how you basically build out your own self-insurance plan that's designed to function well. There is inherent complexity in running your own insurance. So I think part of the reason why, we see this if you look at Walmart's and the big employers, Amazon's, they've been doing this for years and years and years, and they have economies of scale where it just makes complete sense to do it. But, what about a business with 50 employees or a business with 200 employees who are interested in this, maybe have a partner to kind of help them navigate some of the complexity. But hey, if it doesn't go well, like they're on the hook and they can, potentially could bankrupt their business, right? If they're taking all that risk on internally. So there's some inherent, skepticism that I think businesses have. And ultimately what we're asking them to do is run two businesses. So run your own business, but run a healthcare business too.
Yeah.
And so there's various players that are out there trying to navigate and help businesses get there, but we're seeing increasing number of examples. And as the premiums go up and that burden is more and more on the businesses, ultimately businesses actually don't have a choice, increasingly. And so they're saying, okay, we have to do this, we have to try. And I think there are a lot of folks increasingly out there that have the skills to help them get there. So part of what we're trying to solve at Decent is to really bring to small businesses some of these solutions that have been figured out with much larger businesses, but bring them at the same price points that those larger businesses are able to access. And so there's a lot of interesting and exciting stuff. Direct primary care is a part of that. Businesses have been leveraging direct primary care to decrease their cost in partnership with a forward-thinking insurance product. I'll pause there.
We're talking to Ben Aiken. He's a family physician and healthcare executive. He wrote the Kevin MD article, High-Deductible Health Insurance is Bankrupting Americans. Ben, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, I would say a couple things. One, if you haven't heard of direct primary care, take some time to think about it and look into it. It's really an emerging and very exciting solution on the primary care side. Two, note that high deductible health plans aren't necessarily this kind of great solution that we once thought that they were, with the burden of them increasingly falling on patients themselves. And three, that there are a lot of interesting folks and people that are out there trying to work to change our relatively complex and messy health insurance system. And there's some exciting stuff on the horizon.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.